She's also a member of the Friends of Life Foundation of the AKA sorority. In addition to that, I can go on and on. But I will suffice to say that our other awardee candidate for the Augustus Legislative Community Service Award is none other than the other half of the Griffith family. I'm proud to announce we have a white husband and wife emergency medical service team. And that awardee go to Dr. Arthur Griffith, who happens to be the other half of Dr. Deborah Griffith, who is also a fellow of the American College of Emergency Medicine. His residency completed from Howard University. He is currently the Vice Chair of the Department of Emergency Medicine, Montgomery, Virginia. In addition to that, he served as the Medical Director for the Department of Emergency Medicine for Emory Johns Creek Hospital, the Emergency Department at Dunwoody Medical Center, and then we go down Howard University, St. Andrews Emergency Medical Center. Isn't it an honor as we stand and represent and recognize our own? I am truly delighted and excited to bring to you Mr. and Mrs. Dr. and Dr. Deborah and Arthur Griffith. Thank you so much. I'm going to ask each to say a few words because I have their awards, which you know I would definitely make sure they get them. Thank you. Thank you so much. Thank you.
Well, thank you very much. I am truly humbled to actually accept this award and definitely giving thanks to Dr. Satcher. I have definitely listened to your words many and many times through Georgia State Medical Association. And Dr. Georges Benjamin, it's incredible that we would see you here because I actually went to Howard University to be taught by my matriarchs and patriarchs, and now I'm becoming one of those matriarchs. Anyway, but thank you for everything, and Dr. Jenkins, thank you for your wonderful words. I really have realized something fell into my lap that I just had to go on and do. I find myself more and more being that person who actually ushers in that next generation of physicians and lets you know that, and physicians and students knowing that you can do anything you want. Anything you want is possible. And sometimes just me being there is interesting. I don't even realize that students will come up and ask me, thank you for being here, thanks for taking your time with me. But that's just something I do because we have to make a difference in this world and we have to open those doors for our people because healthcare is a right, but education is also a right. So from the medical students that I teach, the scribes that work with me, and down to the young students that I do programs with in elementary schools to make sure they have the education and they're not hungry when they're going to school. And opening up those programs, it's up to us. It's up to us to make that change and to decrease that gap and to decrease the health disparities. And part of that is decreasing the gap in education and increasing the opportunities open to all of us. So thank you very much, and I'm very, very humble.
Thank you so much, and I'm so proud and happy to be married to such a brilliant, beautiful, elegant, my partner in life, my partner in crime. I've been so blessed. I've been so blessed. When I came to Howard University, I met Dr. Poindexter, and he was one of the first ones I learned from as far as public health. Dr. Georges Benjamin, we have always looked up to as one of the stalwarts and cornerstones of the specialty of emergency medicine. My grandmother was an educator for 50 years, taught from the coal mines of West Virginia to the inner city DC, to bring our young people up. My father taught me what public health was even before I knew the term. He was a dentist with a doctorate in facial macular reconstruction. He took the family to Sri Lanka, which was Ceylon back then. They spent 2 years there where he did work. I wasn't born there, but I was conceived there and still enjoy the food. He took our family to Cairo, Egypt for a year, where I worked at the American University in Cairo. He took several tours on the ship Hope, where he provided care in the communities on the west coast of Africa. He taught me that you go out with a mission and what you think the people need. But if you're not listening, you can't provide what they actually need. He said to me, and this was 40-something years ago, he said, our mission was we would go there and fix these cleft palates and do this wonderful thing. But the local provider said, well, that's well and good, but once you leave, we're at the same place. Teach us how to do it. And they changed their mission. And it became a wonderful thing, because then the providers locally could do it. Public health. I think of my brother who has passed. He was a dentist also, with a master's in epidemiology and biostatistics. He taught me personally, and also my wife, while she was a student, what these studies mean. When you read a study, read that study.
That's right.
Look at the sample size, because anything can be proved with faulty data. So know what you're reading, and please know what you're quoting. But we have an opportunity to be mentors in our community. I'm now at this stage of my career I'm blessed to be working with the veterans at Caucus in Montgomery, Alabama. I run home so I can go to my mentoring sessions at elementary school. And it's important to start when they're young, to show them anything is possible. Yes. Thank you for your leadership. Thank you, Dr. Thank you all.
For our academic institution recipient of the Community Service Award, Spelman College.
Good evening, everyone.
Good evening.
Good evening.
My name is Dr. Rosalind Gregory Bass. I'm Director of the Health Careers Program and Faculty in the Environmental and Health Sciences Program at Spelman College. Today, I am here on behalf of Dr. Mary Schmidt-Campbell, our 10th president. She had a prior engagement. However, we want to definitely thank you all for this honor. We sincerely thank the National Black Caucus of Health Workers. Your work as an organization definitely has not gone unnoticed. The one thing that I can say about Spelman College, especially in light of the award that we received, is that when young women come to our campus, one of the first markers that they see is Spelman College is a place where women serve. It's a time-honored tradition in our family as a graduate, where we come as children and take a picture by the marker, and then again take another picture at the time that we're graduating. But it sets the stage for understanding that it's not an option to serve, but it is an expectation. And so our journeys have, especially when looking at all of the alum who have come through those hallowed halls and who have gone on to do phenomenal things, it is important for us to understand our history. It is important for us to know that we are not the first, but that we stand on the shoulders of women who have come before us, such as Dr. Sophia Jones, the first Black female graduate of University of Michigan who came to Spelman in the 1800s to start the first training program, nurse training program for former slaves. We stand on the shoulders of Dr. Georgia Dwelly, the first Spelman alumnus to get her MD from Meharry Medical College, as well as those alums like Dr. Audrey Manley, Dr. Deborah Prothro-Stitt, Dr. Virginia Floyd, Dr. Frida Mass Jackson, and all of the women who are committed to making sure that we address the care for the underserved, and that our students know that before they leave, they should actually reach to their right, to their left, and behind, so that they're able to move forward as a collective to battle conditions associated with racial injustice, health disparities, as well as educational inequalities. And so, again, on behalf of our institution, we sincerely thank you all for this honor. And I'll just say for Dr. Jenkins, as someone who knows her Gullah history, growing up some from Watermelon Island and Edisville Island, that we must continue to educate those who are coming behind us so that they know what their charge shall be. Thank you.
Okay, thank you. Next, we're going to honor the A&B Social Justice Commission for them being the recipient of the Lewis Stokes Legislative Award Service.
Sister Jackie DuPont Walker was not able to be with us this evening, nor was Reverend Jackson, Bishop Jackson. But because they are working on a legislative piece for us right now. And so the Social Action Commission is very grateful for this award. The Health Commission is grateful for our collaborative work. They help us do our work around affordable care, the Affordable Care Act, as well as any other health piece of legislation. They keep us informed so that we can then do the best that we can do. Neither one of us, Sister Jackie or myself, or either Bishop, can do work by ourselves. It is a collaborative work. And so I know that there are members of the Health Commission as well as the Social Action Commission that are here. And since it's difficult to get out of your seat, if you'll just raise your hand for us on that.
Is Dr. Virginia Kane here tonight? Can you come up, please? We'd like to thank Dr. Kane for her selfless contributions in making this Dr. King, without your selfless contributions and always being present and giving us direction and guidance, we just want to thank you for making this event a success. We want to present you with this testimonial resolution signed by all members of the Detroit City Council. And also a certificate of recognition for your hard work from Congressman John Connors and also Congressman John Lewis. Next, I want to pass the mantle as president, from president-elect to president, to Dr. Barbara Norman. I met her during the 2015 Caucus of Health Workers business meeting. Since then, she has continuously been supportive of my endeavors. When I'm right, she'll say to go forward. If I'm wrong, she says no. So she'll teach me or correct me, and I thank her for everything. She's opened up her house to me during my visits in Chicago, just like she had nothing else to do, but I appreciate her. And so I would just like to honor her for all her contributions. First, I'd like to present this testimonial resolution to Dr. Norman. It was signed by the Detroit City Council. And also the certificate of recognition from Congressman John Conyers and Congressman John Lewis.
I just love you. I just love her. Thank you so much. And that's why she told me to keep my remarks short. But I appreciate it. You know, I'm going to have mine all over my front room. Unlike some of you who are so humble. I want you to know I'm excited. Thank you very, very much. All right, I know I'm getting ready to wrap it up because I can tell your stomach saying I'm hungry, hungry, hungry. But you must admit, wasn't this beautiful? Don't we have so many talented people? As a former captain myself in the United States Army, I want to salute you and my cousin there. Thank you very much, all of our honorees. And I want to salute you for coming out here and spending this time with us. I especially want to acknowledge our students. How many students are in the audience? Isn't that wonderful? And I have to acknowledge them because I was reminded last night when Dr. Saxon was talking, you know, when he was talking about his experiences here. And I was sharing with them when they were talking about when we first started with the Caucus. And I go back to like 40 years or 38 years with the Caucus. And I remember the time when we would come to the conference, you didn't see many of us. If you did, you may see one or two here and one or two of us over there, you know, right? And then out of the one or two of them act like they didn't even know who you are or who they were. And that's the reason why those of us who share the common goal and the camaraderie realize that we stand by yourself, you're invisible. That's right. But that next day when you walk in that conference room, when you walk in collectively and arm, you are quite visible and you'll be recognized. And that was like the founding of our caucus. Not only was the public health, most of our professional organizations have had the same experiences. And this is the way we came together to help support. In order to grow, we must support our youth. We must support those who are coming. Even though you're at this conference today, it looks like it's a lot of us out there. But there's still only a few, because when you go back to your individual school, and you had to deal with the administration and the faculty, people like me, you don't always get what you know you're entitled to. But the purpose of the caucus and the member and the board is to let you know that we're here to help service you. I don't know, is a young lady named Keisha here tonight? She was in the student meeting Monday night. Is she here? I want to acknowledge a young lady named Keisha Alexander, I believe her last name. She came to our meeting and she has agreed, she graduates next May. And she had agreed to be the coordinator network for the student body that was in attendance the other night. You remember? We had agreed, we have over, by the way, those of you who were there, who attended and participated, we have now received close to 130 signatures of the name in the email that hopefully we can pull that information together. We plan to develop a profile form, which will go out to everyone who received the email from. Those of you who are here who also would like to participate, please sign up and give us that information, because we're going to compile it and hope to prepare a compendium. So when you attend the conference next year, the 5th year anniversary of the Caucus Poindexter Award, that we will have it available to you, hopefully before then. It would identify all the students, it would identify the faculty, it would identify individuals who are support, who's interested, You'll be able to contact them, help get information. We also plan to have next year a scientific board presentation for those of you who are going to be graduating in May, who have completed your thesis. I know somebody told me they're doing one in the epidemiology, somebody's doing something environmental. You thought I forgot any. I know we got somebody who's presenting one in maternal child health in comparison of fibroid tumors. We have one that's doing one about the hair, the difference of the hair. Thought I forgot any. I told you I'm raised in the church and we had to read the Bible from Genesis and Revelation. So you think I'm kidding? Do you think I'm kidding? So, in addition to that, I know someone else asked me for the plans for next year and the partnerships that we made, and of course with Dr. Richardson and with Dr. Sandra. After that, the meeting, hopefully we can create more partnership, because you know the challenges that we have now in having to support students financially. And we want to start setting up some kind of partnership for those of you who want to attend. Start preparing now for next year for San Diego. Certainly it's not going to be exciting as it is here in Morehouse, but we'll do the best we can. So with that and any other information or questions or answers, I will turn it now over back to our president. Past president, I am now president for the 1950s. Okay, and now for our benediction. Oh, isn't this exciting? I want to thank you. This has been beautiful. I don't want to go home. Okay, now for benediction. Oh, I do want to say one other thing. Who mentioned about the CBC? Was that Dr. Jenkins talking about the